Hi, this is Dr. Christina Hammer coming from Vibrancy VIP Med Clinic, here to talk to you about atrophic vaginitis. So, what is atrophic vaginitis? Atrophic vaginitis is when we lose our estrogen in our body. And I tell my patients that it's really important that you know what atrophic vaginitis is because it affects so many people. So after we go through menopause, we lose our estrogen hormones because our ovaries are like, I am done spitting out eggs as well as giving out the estrogen. Now, once we get rid of that estrogen, our vaginal as well as urethral tissue shrinks. Now, what does that mean? So when we lose the estrogen, which our genital urinary tract is laced with, that estrogen causes those cells down below to be nice, plump, full of lubricants as well as moisture. But when that estrogen goes bye-bye, what happens is those cells shrink, become irritated, deflated. They lose volume, moisture as they become inflamed and irritated, as well as can bleed. So some of the causes, people say, well, what happens how do I know if I have atrophic vaginitis? I tell patients that's a great time to talk to your doctor or healthcare provider about it, saying, hey, any of the symptoms that you may be having, what are some of the symptoms to look out for? Vaginal dryness, feeling itchy. Maybe you're having pain with intercourse. Maybe you're having spotting or bleeding. Maybe you're having irritation with just even wiping after going to the bathroom. Any of these signs are things that you should bring up with your healthcare provider because it's very important that you discuss it. And because that estrogen affects our urinary tract system, another thing that I do tell patients, a symptom you can notice, is pain with urination. A lot of times people will come to see me and say, I think I have a urinary tract infection. Well, when we run their urine, everything is normal, but they say, well, what is causing that pain? Well, the pain is caused from the lack of estrogen lining our urethra, which then causes the pain with urination. After menopause and we lose that estrogen, what are some ways that we can help bring back that lubrication as well as that volume? Well, there's lots of different options. For my patients that do not want to do any hormones, that's okay. I do advise to use maybe coconut oil, maybe even almond oil, or even maybe Astroglide. People go, will that help? I say absolutely, because it's going to bring back that moisture to that affected area. We also have some topical hyaluronic acid samples that help bring back that collagen down below. Another area for my patients who do like to use hormone replacement therapy, or if that's an option that they are okay with, I do recommend either a vaginal lubrication such as estrogen cream, or maybe the BioT pellets, or even some type of topical estrogen cream patch or oral medication that is going to bring back that lubrication as well as the volume back to those cells. So I tell patients, depending on the treatment options that they're using, you may see results as little as 2 weeks, but I usually tell my patients, do not expect to see any results sooner than 2 weeks. I like to look around that 3-month time because that's when hormones like to optimize. And then if they're still not having success with the treatment, that's when they have them come into the clinic so we can talk about any kind of sign or symptom that they're still having. So ways that we know that maybe someone is experiencing atrophic vaginitis. I do tell patients after a consultation, I do like to do an examination on them. So I tell people we will be doing a pelvic examination. Why? I have to take a look at that tissue to see if that tissue is maybe pale in color, very dry, lack of lubrication as well as moisture, as well as sometimes, it can be other things that may be causing them pain. And the only way to diagnose something is actually looking as well as feeling. Another option after we do the examination is going to be blood work. Why is blood work important? Because if anything is imbalanced in our body, we have to look at blood work to see what we need to optimize, to find out what the real reason causing those symptoms are. So for all you ladies out there watching this video, if any of this information sounds like something that's hitting home and close to you, feel free to contact us at the link below. And if you liked the information that I provided today, hit that like button, hit the subscribe button, and we'll see you next time. Bye.